Nurses, everybody wants to be a nurse until it's time to do what nurses do. Everybody wants to be a nurse until it's time to do what nurses do. And I'm not talking about dealing with blood. Some people do that. I'm not talking about cleaning up vomit or changing diapers. I'm talking about working the holidays. That is what nurses do. So right now, if you're in the US, it's Labor Day. And I was getting all types of emails like, oh no, I won't be in. I'll be off today. The company is shutting down. Our offices will be closed. But guess what? We're nurses and we work holidays. So you showed up to class because we are going to grind today. It's a new Monday. I'm so blessed to be here on this day. And I hope you feel that gratitude too, that we get to start a new week again. We're actually doing a topic called tuberculosis. Whether you are in nursing school or you're preparing for NCLEX, this is one of those topics you must master because people have tuberculosis. And number one, they don't even know that they have it. Number two, it still kills a lot of people worldwide. And the treatment for tuberculosis is quite complex. So it depends a lot on what nurses are going to be doing when they come in contact with these patients. So it's on your NCLEX exam. It's on your NCLEX exam. Shout out to everybody all over. Let me know where you're from. What countries do I have? What states do I have here? Let's get into it. But announcements first, really quickly. Back to school. Nursing 101 is happening. If you have not registered for it, it's a free event. Go to remartnurse.com/back to school. This is dropping on Monday, September 9th at 9 p.m. No, 8 p.m. Why did I say 9 p.m.? It's definitely going to be 8 p.m. Okay, so workbooks will be coming out. And make sure that you have your workbook ready for class. We're going to talk about how to study. We're going to talk about pharmacology. We're going to talk about fundamentals. So this is going to be a great event for everyone to attend, and it's free. All right. I'm going to start pivoting, talking more about nursing school, how to be successful in nursing school. So just be prepared for that. Okay. Happy Labor Day. Yes, everybody. We are working on the holidays. That's okay. That's all right. We're going to get paid for it soon. All right. So let me start with tuberculosis as a concept. Get ready to put this in the comments. When we're talking about tuberculosis, are we talking about a virus or a bacteria? Can somebody tell me that? When we're talking about tuberculosis, is this a virus or is this bacterial? There are several ways, there are several places in the program that you will find TB as a discussion. Of course, I traveled to Dallas and I don't know where all my books are, but it's in the nursing school V2. I just had that book. Here it is. Quick Facts for Nursing School. This is the one I was working out of when I prepared for this lecture today. So it's in this one. Put the page, if you have my Quick Facts for NCLEX, put the page where it's in there. Yes, this is a bacterial infection. Now, when we are talking about TB, great job, everybody. Bacteria. Yes. When we are also talking about TB, because there's so many layers to this, are we talking about acute or are we talking about a chronic condition? Acute or chronic for TB. And this is what makes TB so important to understand for your nursing school or your nursing education. Here are my notes. Quick Facts 87. If you have Quick Facts for Nursing School, is page 117. So this is why we need to know about tuberculosis, because patients can have this as an acute or as a chronic condition. I would say tuberculosis is more of a chronic condition than an acute condition. I'll explain it later, but if you know why I say it's more chronic than acute, put it in the comments. All right. So for my audiovisual learners, my readers, tuberculosis is an airborne disease caused by the bacterium, and I saw somebody had put this, Mycobacterium tuberculosis. And so this is a very serious infection. It is very aggressive. The cellular wall of this particular bacteria is very strong. It has the ability to keep defenders out. It has the ability to invade our own cells and change it. So this is not a condition that you play around with at all, right? Signs and symptoms include weakness. Oh, we know the good old night sweats, weight loss. Patients, when their immune system is trying to attack and it is up on the mount against tuberculosis, that patient is going to have a cough. That patient is absolutely going to have a cough. The patient will have a fever as well. And there will even be chest pain because we know on the onset, TB is going to attack which organ, all right? The patient will have what kind of condition? So the lungs are going to be affected. All right. Now, very important for your NCLEX exam or for your exit exam, TB is not found in the environment, meaning you cannot get tuberculosis from surfaces. You are not going to find it if you use a bathroom or anything like that. It is directly spread from person to person. And this is what makes it so aggressive and how it spreads so quickly, especially in communities where people are living very close together. So TB is spread from person to person through the air. And the tuberculosis, the airborne particles, the droplet nuclei, they're pretty large. And so these droplet nuclei, they are dispersed from a person when there is some sort of respiratory activity in the way of a cough, a sneeze, even if you shout and you have droplets come out, or if you are singing, then you can be a very, very, very bad person to have in the environment, because you're going to be spreading this disease, whether you know you have it or you don't. And this is why I say that TB can be considered chronic, because there are people who have TB and they do not know they have it. Okay. So this is latent TB. And it is people who have the TB infection. They have the germs in their bodies, but they are not sick because the germs are not active. Right? I tried to make that as simple as possible. They are carrying around the disease, but it is not activated. TB disease. People with TB disease, tuberculosis that's active, they have the manifestations. The germs are multiplying. They're destroying tissues in the body. It is activated. Okay. So yeah, asymptomatic, symptomatic. I like that, Edith. People who are at risk to contract tuberculosis, of course, patients with HIV. Children are more susceptible. People who are recently had this, okay, they recently had tuberculosis and they got treatment for it, and then it comes back again. Okay. People who do not take their medications fully. People who are on an immunosuppressive therapy. So maybe they're on a corticosteroid, prednisone. People who smoke. Yes, there are many different risk factors, even than the ones that I present here. These are the major ones. People who live in, people who are in a migrant camp, sometimes who are in a impoverished area because they don't have access to the treatment. If one person gets it, then that entire community can also get it as well, because it is, again, spread airborne. Yes. Oh, someone said prisons. Mary says prisons. All right. And I love the study group that we have going on right now. There are different sites for the TB disease. So, of course, there's a pulmonary. So TB most commonly affects the lungs. I saw that in the comments, and this is referred to as pulmonary TB. People who have pulmonary TB, our patients, they usually do have a cough. And on the chest radiograph, we can see that there would be infectious processes happening. Now, there's also patients who, unfortunately, the tuberculosis is so aggressive and so virulent that it occurs in other places than just the lungs. So you can see it creeping up into the larynx and the lymph nodes, the pleura, and then even the brain, the kidneys, the bones, and the joints. I want to stop and pause for the cause because there is a procedure that we learn about in nursing school, and it is to help to diagnose this particular problem. Okay. And there are some, great things that we need to know about the Mannix tuberculin skin test, but there's also a major point that I don't want you to miss. If you've read this somewhere else or you went over it in nursing school, let's just revisit it again. Okay. So this is a test that's usually done when you first get your nursing job and you have to go to employee health. One of the things that they're going to make you take is this, okay? And they are going to see whether or not you have tuberculosis. And as nurses, if you're working in a clinic or employee health or community health, you'll be giving this. So anyways, what happens is this. A small amount of a substance called tuberculin is injected just under the skin. It's an intradermal injection. So we know what that means. Usually in the forearm, the inner forearm. And so tuberculin, all it is just a PPD. So we call it a PPD skin test. And that means a purified protein derivative. So it's PPD. And it's made from the TB bacteria, but it does not cause tuberculosis. Well, what happens is we're going to inject a small amount, okay? Intradermal needle, 0.1 is injected in the top layer of the skin. And what we are going to see, and this is where we have to understand, we're going to see a raised bump. That is not the test. That is not the diagnostic criteria. Everybody will get that small raised bump. It's called a wheal. So this is for NCLEX. So if a nurse or a new nurse injects tuberculin in a patient's arm and a wheal forms, that does not mean the patient is positive. Okay, let me go back. So anyhow, you need to wait after that 48 to 72 hours. And then at that time, the body has had enough opportunity to react. And if the healthcare provider or the nurse sees the injection site and there is a raised hard, it's called induration, that thing is measured, okay, in millimeters. The reason why I'm doing this is because this is a diagnostic that nurses interpret, okay? So that is what I'm talking about. Now, is this an induration or is this a wheal? Put it in the comments. Is this considered induration or is this considered wheal? I love when we come to class, we are studying together. This is the process of content. We ain't had not a single question yet because we're not ready for questions. Okay. This is the REMAR difference, guys. We're going to do that content first. We're going to be competent about what we're talking about. This is the wheal. So anyhow, if there is 48, because the wheal is going to go away. If there is a raised firm bump, because that wheal is going to be kind of fleshy. If there's a raised firm bump, it means that the patient has been exposed to TB. Now we're looking for an induration of about 10, which is considered positive. Some sources say 5. Let's just go with 10 as a general. Okay. If there is no bump or the bump is very, very tiny, 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 this usually means that the patient has not been exposed to TB. Okay. Or their immune system did not react to the test. Now, let me make this clear too. Sometimes NCLEX will say, well, in the inner forearm, there's no wheal, but there's redness. and this is all red, okay? Even if it's red, that is not considered a positive response at all, okay? We don't care about the redness. We don't care about a little teeny tiny bump. We're looking for a firm induration. Okay. Now, here are my questions to you now. What are the limitations of the Manox skin test? What is the limitations of it? Okay, because pretty much everybody's going to start here. But even if, when I say limitations, even if this is positive, what's wrong with the positive? Because it won't give you the full picture. So what are the limitations of this test? Meaning, why do we have to go further? Meaning, somebody put, why do we have to do the chest x-ray if this is positive? Why isn't this enough? Somebody want to put that in the comments? I'm pressing you. I'm just a little bit. I'm pressing you. Okay. So a person, because somebody says, because. That's it, just because. It could be a false positive, okay? Because somebody said, no, that was going to be my question. You asked me the question I was going to ask you. Okay, so the limitations, let me see if I can get back to where I need to be. The limitations is this, because even if you have an induration, it does not show if this is active or latent. Yes, you will know that your patient has been exposed to tuberculosis at some point, but we don't know if it was like last week or if it was when they were 3 years old and now they're 42. So that's one of the limitations of this specific test. It does not provide a full confirmation. Okay, I'm moving on. So there are some other things that we would do. The chest x-ray, of course. You could do a sputum culture. You may even want to do a Western blot. That may help you with a differential diagnosis, CT, MRI scan, pulmonary function test. And these other diagnostic criteria, they're very important because, and let's do this, here's another critical thinking question. Where, let me say that. No, I don't want to say it like that. When we're talking about tuberculosis, what else can present like tuberculosis? Give me another disease process that you know, we studied it, something else that can present like tuberculosis. What is it? And remember the signs of tuberculosis. What are people going to come in? Cough, chest pain, fever, night sweat. That's what I was looking for. This one I was looking for. I was looking for this one. I was looking for this one. Let me see. That one. And there was one more. There's some interesting ones. Let's see. Bronchitis. Okay. We got to always throw that one in there. That's the new one. Yes. So yes, great. So tuberculosis can present like other things. And so we have to be very, very vigilant in trying to find out what exactly it is. All right, let's go on. Good job. Let's go on. Because of this, the treatment for tuberculosis can be very long. It can be really long. And this is one of the major points that NCLEX wants you to take home and bring to the exam. Getting someone to take, and I'm an offender. I hate taking pills. I don't care. I hate taking pills of all kind. Getting somebody to stay on a treatment for a week is difficult. But you're talking about a 6 to 9 month plan. Forget about it. Which is why this condition is still a problem on the earth. The first line of the treatment, and this is the one that I want you to focus on, because you have a first line of treatments and then you have the second line. So the first line is going to be the acronym STRIPE, and that stands for streptomycin, rifampin, isoniazid, pyrazimide, and then ethambutol. These medications within themselves all have their own teaching point. And I may have to do a separate live just on these medications. However, what I want you to know is that along with these medications, we are stressing to the patient that if you do not stay consistent with the first line, okay, and you have to go into, and you get a resistant form of tuberculosis, you get an antibiotic resistant form of tuberculosis, you are going to be in trouble, because these medications are easy to use and they're cheap. They're relatively inexpensive. The second line of medications are going to be more expensive, and unfortunately, they're going to come in with even more side effects, because we know that these medications are not perfect. So treatment goals: get your patient to stay on track with their antibiotics. Okay. All right. Our nursing considerations are, of course, we need to make sure that our patient understands that their environment is going to contribute to their healing, and even, even the position, because they're going to have a lot of fluid buildup as their body tries to, deactivate what's happening with the bacteria. So there's going to be a lot of drainage that can be produced. Encourage the patient to also adhere to the treatment, because if you start the treatment and then stop it, you are going to be at risk to develop a antibiotic resistant form of tuberculosis. That's going to be very hard to treat. And then also that could put you at risk for, dare I say, death, because this particular bacteria, it intends to take over the entire body. Okay. Promoting client activity, adequate nutrition, educate the patient that, they're going to have to practice proper hygiene and isolation when it is ordered by the physician. And then also we're going to have to teach them about the medications that they are taking. That is our job as the nurses, to make sure they feel supported in the prescriptions that will be written for them. Okay. Again, everything we do here is so that when we turn off this broadcast, you feel empowered to study on your own. These are things that not only do you have to memorize, but you have to understand. Okay. And all the questions that you guys are asking, that is the purpose of this broadcast. The purpose of this broadcast is so that you're able to self-mediate where you are and what more work that needs to be done. Okay. So all the questions that you have that you're trying to ask me, guess what? I'm turning them back on you, and I'm telling you to go and find out for yourself. You need to be able to take responsibility and accountability in this process. None of this stuff is just going to soak into your brain, because that's just not how it works. It takes a significant amount of effort to change something. Okay. So don't ask me about the laboratory values if you don't know them. Don't ask me about the co-diagnoses if you don't know them. Go and look that up for yourself. You have a workbook, write it in there. Okay. Write it in there. This is part of, and then let me just show you. Here's product promotion, because you do need to know isolation precautions. That is huge. Making sure that you are aware of all of the isolation precautions that you will be presented with on your NCLEX exam. Now, we've done some content. Now let's do some questions. Here is my first question for you. Question number 1 is this. A nurse A nurse is caring for a patient with newly diagnosed active pulmonary tuberculosis who has already been placed in isolation. What is the next priority nursing intervention after isolation? What is it? Is it number one, initiate a high protein, high calorie diet to support the patient's nutritional status? Two, informing the team of the patient's condition. Three, educate the patient on the importance of adhering to the full course of prescribed anti-tuberculin medication. Or four, getting daily sputum samples. What say you, Remar nurses, on this Monday? We are studying. This is good stuff. We spent some time talking about TB. Have to know it for NCLEX. What do you say here? What is our priority? Our priority is going to be, if you picked number 3, you got it right. Remember, we stressed the importance of that patient adhering to the prescribed anti-tuberculin medications. And I hope the number that I gave you in my mind, you remember, okay? And that is one of the challenges that we have. So after isolation, because that's going to be an option, after isolation, then the priority is education, okay? And just letting the patient know that it is very important for them to complete all of their antibiotics. Okay, I'm moving on. Next question is this. Let me see if I get to it. Boom. A patient with active pulmonary tuberculosis is refusing to remain in isolation and insists on leaving the room. What is the nurse's best response? Number 1, you must stay in your room. Leaving could result in disciplinary actions. 2, I understand your frustration, but it is critical for your health and the safety of others that you remain in isolation. 3, if you leave the room, I will be unable to medicate you anymore. 4, if you wear a mask, it will reduce the risk of everyone getting sick. Let's go. It's Labor Day, and we are in the process of laboring. We're laboring to get our nursing license. We're not taking days off. We're not taking days off until we get the license. So it's the opposite. We're actually doing the work right now. Correct answer is pow. Number 2, I understand your frustration. It is critical for your health and the safety of others that you remain in isolation. This is NCLEX. This is how we talk to our patients, okay? So the nurse should acknowledge the patient's feelings while clearly explaining you still need to be here, okay? And trust me, when you become a nurse, you will be doing this a lot. And it really works because the patient can say, you know what? I hate you. I never want to see you again, okay? And you will respond back, I understand your frustration. I know you don't want to see me again, but I'm here to help you. Okay. I'm here to help you. I remember a patient, one of my first patients, he didn't have any legs. And I, being a new nurse, just came in there to give him some water, but he was upset because he didn't have any legs. And he said, if I had legs, I would kick your, and I just was like, sir, I understand, but I'm here to help you. This is nursing. This is the nursing nobody wants to talk about. Okay, so question number 3, let's get into it. All right. A patient with active pulmonary TB is in isolation, but he is becoming agitated and restless. He is worried that isolation is affecting his mental health. What is the best response by the nurse? Okay. So number 1, administer a prescribed anxiolytic medication to help the patient relax and reduce anxiety. 2, explain the importance of isolation and measure and reassure the patient that it is only temporary until they are no longer contagious. 3, offer the patient educational material about TB that clearly explains the condition. Or 4, contact the healthcare provider to speak to the patient. Okay. All right. I see the answers on the screen. Okay. All right. So I just want you to know that I'm just warming you up. Okay. So I'm giving you some ones that you could probably figure out. Okay. So if you got this one right, you're ready for my next one. Correct answer is 2. 2. Explain the importance of isolation. And this is big for NCLEX because these patients, even though nobody likes to be isolated, it is a restraint, right? You have to stay in the room. You can't leave. What we can do as nurses is provide education. Okay. You have to stay in here. You don't have to stay in here forever. It's just a short period of time. We want to tap into the patient's, desire for their own health and the health of others. Okay. So you got that one right. Good. Are you 3 of 3? Are you 3 of 3 right now? All right. Let's see if I can challenge you. I'm going to turn the heat up a little bit more. This next question is this. A nurse is caring for a patient with tuberculosis who is receiving streptomycin. Which of the following assessments is the highest priority to monitor for potential adverse effect? Okay, so we're talking about this. Assess the client's respirations and evaluate bronchospasms. 2, assess the client's skin for rash and for signs of an allergic reaction. 3, assess the client's hearing. Or 4, monitor the patient's blood glucose levels for signs of hypoglycemia. Okay, so all right. Did I turn it up a little bit with this one? So if you get this question in front of you on the NCLEX exam, which one are you going to go with? This is good. I see 1s, I see 2s, I see 3s. So glad you showed up for class today. I'm so glad you're here. Correct answer is number 3. Absolutely number 3. And this just goes back to you knowing the content of aminoglycosides. If you got this one wrong, you need to open up the V2 workbook, okay? And you need to turn to page 42 and all these notes, because we went over this. We like this one. That's one of my book, like all these notes that you write while you watch the videos, get in there, okay? Get in there. You cannot miss this one, okay? You cannot miss this one. Let me just read you. This is why it's so important. Streptomycin is an aminoglycoside. Okay, y'all know that. All right. It is known to cause ototoxicity, okay, which can lead to hearing loss, tinnitus, balance disturbances. And look at my mouth, very, very, very much so. Very important point with aminoglycosides. Your body has a significant ability to regenerate. Sometimes we're like lizards and there's parts of our bodies that can heal and the tissues can get better and you can recover, right? You cut your arm, the tissues will regenerate. But there's one place on your body that does not do that, and that is your inner ear. Your inner ear has different cells than other places, particularly the hair cells that conduct sound and conduct vibration. So when streptomycin becomes toxic, it builds up in your ears and it eats away the cells of your ears, which means that once those ear cells, those hair cells are gone, guess what's not coming back? Your hearing. And so the ototoxicity, the hearing loss that is associated with a streptomycin, is permanent. It's irreversible. This is something that you cannot ever forget, okay? Because the person that picked anything other than 3 here is not safe. All right. Bronchospasms are not associated with streptomycin. You can have a skin reaction. Some people pick number 2, is evaluate the skin for rash. Remember, we're talking about the skin here for signs of an allergic reaction, which a patient may have, right? We know some skin changes, but we are not going to ever put that over the hearing of a patient on an aminoglycoside, because that hearing can be lost permanently. Never forget. And this is why you come to class. Okay. And this is why you do REMAR and not all those other little things. Don't be cheating on me with other NCLEX reviews, because this right here, this is where we form a partnership. Okay. All right, let's go. Next question. I said I was turning it up. I meant I was turning it up. Here is question number 5. It is this. A nurse is caring for a patient. Oh, this is a good one. I like this one too. So a nurse is caring for a patient with HIV. The patient presents with symptoms. Which of the following will most likely be present if the patient has active TB? Oh, this is good. Because you know the patient, you know the scenario. Okay. Number 1, fever. Number 2, night sweats. Number 3, cough. Number 4, generalized fatigue. Oh, so yeah. And remember, everything we need to know to answer the question is in the question. So this has layers. We talked about tuberculosis. What do you know about HIV that you can make the leap? Okay, so you have a patient with HIV, they present with symptoms. Which of the following is most likely to be present if the patient has active TB? Okay, correct answer is going to be number 4, generalized fatigue. Why? Why is it generalized fatigue and not what y'all always picking that productive cough and the night sweat? You're not going to see that. Why are you not going to see that? You're not going to see that in patients who are immunocompromised. You won't see it. So somebody with HIV, their immune system is weak. So if a healthy person comes in contact with TB, that immune system is going to be like, it's go time. You're going to get a fever. You're going to get a cough. Your body is going to be flaming up to try to get rid of this tuberculosis, right? So you're going to have the productive cough. You're going to have the night sweats trying to get this bacteria out of the body. But if you're immunocompromised and tuberculosis comes in, immune system's going to be like, I can't do much. I'm already maxed out. I got nothing to give. Okay. So you're not going to have the fever. You're not going to have the night sweat. Body can't do it. Okay. You're just going to be like, I'm tired. Like I'm more tired than I usually am. Okay. Listen. This is what I'm supposed to do. You guys love when I do this, when I challenge you. All right. And I love coming to class and I love seeing how we respond. Let me just read this for my formal people that are just like, can you read me the rationale? So I put, in immunocompromised patients, TB may present with atypical symptoms or more disseminated disease due to the weakened immune response. They may not show classic symptoms like fever or cough, but may instead present with systemic signs like weight loss and fatigue. So again, some things in nursing you don't know, okay, until somebody tells you. That's all that is to it, right? But it's good that we are studying together today so that we can learn things that we did not know. If we knew everything, then we wouldn't be students of life. We will be masters of life. All right. So I love the comments. I love the testimonials. And I love when we have REMAR nurses that pop up. I got a REMAR nurse that is going to be here today. And this is so good because this is Monday Motivation. Let's get into it. So everybody, welcome Nurse Alexander. Hello.
Hello, hi.
How are you?
I'm doing pretty good. I can't complain. I'm very excited. It's Labor Day. I'm a nurse. I'm relaxing, and yeah, it's very good.
Very good. Now tell me, we got like 700 people here. Not to put any pressure on you. There's only 700 of us today.
Only
Uh
700.
almost 800. Two more people hop on, we'll have 800. What do you want to tell us about NCLEX?
NCLEX is a test that hearing you that you had to deprogram how you put your mind in nursing school. So you
Mhm.
had to deprogram how you was taught in school in order to get taught how to pass the test, pretty much.
Elaborate on that.
Because sometimes in school it's like I was in a program that was very fast, so you tend to like learn for the exam for that point in time, so
Yeah.
you're not retaining, you're just
Mhm.
doing it just to pass the test.
Got it.
So I didn't pass the first time because I came with that same mindset, like,
Oh,
oh, I could pass the test, I'm fine, I'm good, and then I'm not catering to my learning style, so then I didn't pass the first time. That was a problem.
yeah. Yeah. What made you tell me, how long did you wait between the first time you didn't pass to the second time you
Well,
did pass?
I didn't pass, or I took my test December 13th, and then I was discouraged, but I actually started studying 2 days later on the
Oh,
15th.
really?
Yeah, I just said, let me just keep going.
Oh.
But I changed from Archer
Mm.
to your program.
Hmm.
Started on the 15th because I actually was in your 7 day classes. I was
Yeah.
doing that as well. So that's how I began. And then I took my second exam May 14th after I did your training, and I did it over again like twice.
Makes sense. Okay. Um, what made you then I'm asking this because I get this. What made you did you know about Remar before you knew about Archer, or did you know about Archer first?
Well, this is the funny thing about it. In school, everybody was doing Archer. That was like the popular thing I kept hearing. So I said,
Yeah.
okay, well, I guess I'll go with Archer because everybody else is doing it. All of my
Yeah.
friends passed with Archer,
Hmm.
and I did not. But my sister, it was weird because she's been a nurse for 10 years. She was like, oh, so what are you going to choose? I said,
Hmm.
well, I have between Archer and Remar, and I went with Archer.
Yeah.
And then she said, well, maybe you need to try Remar. I hear my friends saying that it's really good. And I said, well, okay, I'll give it a try. And yeah, I still have it to this day.
Yay!
I still have it to this day.
Oh, let me see the inside. Let me see the inside of the V2. Let me see. We got to do our compare and contrast.
And
Let me see. Did you do the work? Oh, there's the work. There it is. That's what it looks like. That's what the content looks like. Mm-hmm. Mm-hmm.
I I literally had you in my ear, walking to work, walking from work, going to the store. I got this too. Yes,
Love it.
doing this
Yes.
too. I promote you everywhere. I have people who ask me to help them in school, and I said, well, after that, do Remar. And they're
Yeah.
like, and I said, well, listen, first off, she
Remar rep.
takes her time. She takes her time, and she breaks everything down. And I'm a visual, so like when I see the words on the screen, I'm obtaining the words. I
Yes.
do everything in color. I
I
took
see.
your quick facts book, and every class that you have, I wrote everything in from start to finish.
Nice. Quick facts. You turned quick facts into a workbook.
Yes.
Wow.
Yes, really.
What?
I am so happy. And it's interesting because I got my nursing job May 6th,
Okay.
but my test was May 14th.
Oh,
Right. So that
okay.
pressure was like, whoa.
Very much there. Yes. Yes.
Right.
So talk to me about your NCLEX exam. How was it different? Just talk to me. Like, what was it like?
Well, both experiences, I took the entire 150, but
Oh,
yeah, the whole 150. But the first time I knew I didn't pass because I couldn't understand the questions the way that I needed to. But this time around, it was different. I took my breaks. Now, I'm going to be honest, when it turned from 85 to 80 to like 86. I was like, I need a break.
Yeah. Okay.
I'm-
Okay. I got you.
so I went and I came back, and then the questions got really hard towards the end. Like I got a whole bunch of like next gen
Mm-hmm.
items, a whole bunch, and I was like, oh my god, like I'm ready to tap out. But I look and I said, I got 5 questions left. So I did the 5 questions, and I got my
Wow.
results the next morning at 8:38 in the morning. I was listening to, well, Yolanda Adams was playing in the house, and I woke up and I said, okay, let me check this result. And
Whew.
I have my pharmacy tech license. So I was like, okay, let me look. So I'm looking. I said, wait, let me exit, let me look for the nurses.
Mhm.
And it was kind of weird because I jumped up so high, I pulled my muscle in my leg. I didn't care, but I
What?
I didn't care at the moment.
Jumping for joy. Oh
Yeah,
my
I jumped.
goodness.
Yes, that I
So
did.
you know what? I really like your I'm really glad that you're on here today because you took the entirety of the exam. And that is something that maybe a lot of people aren't prepared to do. And somewhere along the way, you can give up and you can
Sure.
become around question 120 or 130. You can give up. Tell me what was the motivation that kept your head in the game?
Well, when we as people we choose to go to nursing school, people do it for the money and do and for the profession. What did it for me is I had no choice. I had to pass the NCLEX. When I because I was in Seattle when I was doing your program, and when I moved back to Florida, I was like, okay, I need to get things done, and it's now. So I had to put myself in that mode. I studied your program even when I was completed. I did it over again. I did videos. I was up to like 7 o'clock in the morning. No job, no nothing, in
Mm,
the same seat, grinding. Did
mhm.
mo- I did motivational videos from your Monday motivational. I play it over again. I did Robert, Eric, and I had a panic attack the day of the exam. I'm not gonna lie,
Yeah.
but I didn't allow it to stop me.
Yeah.
And
Okay.
I'm a nurse in a PCU unit, and I mean,
Oh, progressive care.
care,
Whew,
yes, it's
whoa,
serious.
it's serious business. That
It
was my
is.
first unit. Oof, boy. Mm.
I am
So
reading this.
I
Yes,
hope first shift, I must say, I hope first shift gets you together.
yes, it is. I am reading this. Yes,
Wow. Well, congratulations to
thank you.
you. Because your story could have been totally different. You could have, been spinning the block again on this NCLEX over and over again, or you could have decided, you know what, I'll just use my other degree and not continue nursing. So I'm so proud of you because
Thank you.
you did the tough thing, which is not giving up on yourself, and also being willing to invest in something new, because sometimes I think money is a barrier for people to make more money. Like you
Right.
got to spend money to make money. Like
That
that's a
makes
principle.
sense.
That's
Right.
a
Correct.
principle. And the best money that you can spend, honestly, in nursing is to educate yourself, is to invest in your education. So shout out to you and congratulations. Thank you so
Thank
much for
you.
taking your time to come and talk to
Anytime.
us on this Monday. We are certainly proud of you.
Thank you.
All right. Have a good day. Bye bye.
Bye.
I love it. Remar nurses. We're real people. And Nurse Alexander, his story could have been so different. So different. And I love that he said, hey, I'm an audio visual learner. I need to see some stuff, and was able to make the leap to Remar. Shout out to 7 days of NCLEX. We do that during Christmas time. And even when people are just so focused on just celebrating the holidays, we grinding. So 7 days of NCLEX. We will be doing that again during this holiday season. All right, everybody. So you did the questions, they were challenging. But let me tell you, the real challenge, complete this whole program, not just 5 questions today or 4 questions today. Show up, do V2 workbook, turn that quick facts into a workbook like Nurse Alexander did. He had all types of colors and stuff in my quick facts book, and watch the videos, do the Q bank. It's all there for you. Cannot stress it enough. Our Monday motivation is God's rest for the weary. Come on. Come on. My goal for you is that you get everything done this week. Whatever you want to happen, I want it to happen for you. But I'm also a mother. I'm also a daughter. I'm also a sister. I'm also a wife. That's the most important thing. I'm a wife, y'all. I got an amazing husband. And I know that everything that I set out to get done is probably not going to get done because I am going to grow tired. Is there anybody that can just relate to that? You have a lot of things on your plate, but God understands that we are mere humans. We're going to get tired. This is the scripture. This is the scripture for this week, guys. Here it is. Isaiah 40:28. And I love how it starts because it says, "Do you not know? Have you not heard?" This is encouragement. Like this is the encouragement right here. If you didn't know, they used to say, if you don't know, now you know, right? If you don't know, if you have not heard this, the Lord is the everlasting God, the creator of the ends of the earth. He will not grow tired or weary. His understanding, no one can fathom, no one can question. Okay. And I love this because this is me and this is God. This is the difference between me and God. He gives strength to the weary and increases the power of the weak. Okay. Even youths grow tired and weary, and the young men stumble and fall. And I love when the Bible just speaks to our humanity, even the strongest among us, the young people. I'm not a young person anymore, but the young people that can run and go far and have all this energy, even them, they grow tired. And the strongest among us get weak. Okay. But check this out. But those who wait in the Lord, okay, will renew their strength. Those that wait, that's all we need to do. This is where you and I are, okay? We just need to wait in the Lord and renew our strength in that, trusting in God. Those who hope in the Lord, they will renew their strength. They will soar on wings like eagles. They will run and not grow weary. They will walk and not be faint. This is so important when you are going through a trial, when you are going through a test, to not grow weary because you're trusting in your own strength. You're trying to get it all done. You're trying to make it happen. Listen, even the strongest among us, and this is talking about, when we read this, the young men, growing weary and the strong men stumbling. We're thinking about physical strength, but I think sometimes even those who are spiritually strong, even those of us who are in our word and we're praying and we're connecting with God, it is sometimes even tough to, continue on in that way. Like sometimes you get spiritually tired, right? Sometimes you get physically and spiritually and emotionally and mentally tired. And what we have to understand is that the word of God says that in those moments, God's strength becomes perfect. But it cannot become perfect if we are not allowing him to come in and carry us through the storm. The saddest thing that happens is during our struggles and during our trials, people, they take a pit stop. They stop in the storm. You ever been driving and it's raining and so it starts raining and it's really bad, right? And you decide to stay on the road, but some people may pull over and stop, right? But you just keep going. And then before you know it, you have passed the storm and it's behind you. And you can kind of look back and see people still pulled over on the side of the road because they were too scared or they were like, let me just stay here in the middle of the storm. No, keep going through that thing. Keep driving. Just keep putting one step in front of the other. God promises that I will see you through and you will look up and that thing will be behind you. I love Nurse Alexander's testimony because now that storm that he was in is behind him. He is working as a nurse. He could have pulled over and said, you know what? I don't know what's happening. I'm just going to just not do anything. I'm just going to be here. No, he kept driving through the storm. We have to do that. And we have to trust that when we get tired, God is going to carry us. And that's my hope for us, to understand that whatever we put our mind to this week, surely we can get it done, but we're going to have to rely on something greater than ourselves. Because as wonderful as we are, there is something that is greater, that is willing to help, So our takeaways for Monday motivation. So good. So good. The Lord describes who he is. Like, we never have to guess who God is. Okay. So that we may know that he can do anything, not you, but he can do anything. No matter what age you are, we all have limited physical strength, and that's okay. The tireless God's strength will overflow into your life. Okay. So just remember our takeaways for today. It will help us throughout this week until we meet again. We are going to meet again by God's grace on Wednesday at 9 p.m. Eastern time. Set your alarm. And then we have our new event next week. So we'll have 2 lives on Monday. We're going to have one in the afternoon on Monday, and we're going to have one in the evening. So I hope you will join me. Both of those sessions are free. Both of those study sessions are free. And so come, let's discuss nursing school, how to be successful, and maybe we'll learn a thing or two. All right. So I thank you so much for spending this Monday with me. Remember, you can, you will, and you must pass NCLEX. See you later, guys. Bye-bye.